Hey everyone, I'm Hajira. So today we're gonna crack the clavicle, the collarbone super easily. Don't worry, no boring stuffs, just simple, visual, step-by-step learning. You will be able to recall it in your exams without stress. Who is this for? MBBS, BDS, OT, PTA, nursing beginners. Topics covered: introduction, central features, ends of clavicle, side determination, surface and borders, attachments, ossification, applied anatomy. Okay, first up the general features. The clavicle is kinda S-shaped, sits horizontally at the top of your chest. And guess what? It's the only long bone lying sideways. So next time someone asks, you can say, yep, horizontal bone at the shoulder level. Easy, right? Alright, so the clavicle has two ends. The sternal end is round and connects your chest bone. The acromial end is flat and meets the shoulder blade. A quick memory hack to remember: sternal, center, acromial, arm side. That's it. So let's move to side determination now. Wondering how to tell left from the right clavicle? No worries. Hold it horizontally, smooth side up, curve facing forward. The sternal end always goes towards the chest. Easy peasy. Remember, sternal, sternum. Now surface and borders. Superior surface, smooth. Inferior, rough. And muscles attached there. Borders, anterior, front. Posterior, back. Super simple mnemonic: front, anterior, back, posterior. That's it. Time for muscles. Attachments. Pectoralis major, anterior surface. Deltoid, lateral part. Sternocleidomastoid, superior of medial end. Trapezius, lateral superior surface. A quick tip: medial, middle. Lateral, arm side. Easy to remember while practicing. Alright, here's something cool: ossification. Clavicle starts forming really early, around week of 5th to 6th of fetal life. Two primary centers, one secondary at the sternal end. And there's a fun fact as well: first to ossify and last to fuse. Finally, applied stuff, applied anatomy. Middle third fractures are common. This is where most clavicle breaks happen. Sternal end rarely breaks. And heads up, middle third fractures can hurt nearby nerves or vessels, so landmarks matter. Also, doctors use the clavicle as a guide in procedures like central line incision. Cool, right? Okay, before I give you the full recap, let's quickly test your brain with a mini quiz. Which end of the clavicle is flat? The acromial end. Remember, acromial, arm side. Which surface of the clavicle is smooth? The superior surface, smooth and shiny on top. How many muscles attach to the clavicle? 5 muscles: pectoralis major, deltoid, sternocleidomastoid, trapezius and subclavius. Where is the most common fracture site? At the junction of medial 2/3 and lateral 1/3. That's the weak point. Which bone is the first to ossify but the last to fuse? The clavicle itself. First baby, last to grow up. Final recap. Now let's quickly tie everything together. The clavicle is an S-shape. Start holding the shoulder away from the chest. It has two ends: sternal, round at the center, and acromial, flat at shoulder. Surface: superior, smooth. Inferior, rough. Attachments: 5 muscles and 3 ligaments. Ossification: first to appear, last to fuse. Applied anatomy: fracture common at medial 2/3 plus lateral 1/3. And that's it. Clavicle simple, clear and exam ready. If this free trial felt easy and fun, just imagine the full course where we cover the entire upper limb, lower limb and thorax in the same style. Step by step with memory hacks, applied points and quizzes. So don't wait, enroll now and let's master anatomy together.